There's nothing cuter than little ones or learning you're about to become a mother, unless, of course, you're unable to conceive. And each time you see a baby, your heart saddens. Infertility can be devastating. In fact, 1 couple in 7 struggles to get pregnant. But there is hope. Dr. Juliet Skinner, medical director at the Barbados Fertility Centre, joins me this morning to discuss. Good morning, doctor.
Good morning, Olga.
Thank you for being here.
Thank you.
Doctor, let's talk about that. You know, people get married or they want to have a child and they can't conceive. Painful, frustrating. I could probably think of so many words of that anxiety that's going through them.
Infertility is a devastating medical condition. Let's face it, many people spend years actually trying not to become pregnant.
Right, they're avoiding it.
They're avoiding it, and suddenly, you know, the goal becomes a baby and a pregnancy, and this is not happening. So huge frustrations build up. And I think at the end of the day, ultimately, you know, how long does it take to conceive? Well, most couples are going to achieve a pregnancy within 6 months.
Okay.
The medical definition uses a timeline of a year before then it's appropriate to start medical assessment and treatment. Unless, of course, a lady is older than 35, in which case that advice is altered to be in more than 6 months. We should certainly investigate and treat those patients because the success rates will decrease as a lady gets older.
And doctor, I know there's many factors as to why someone can't conceive. What are they? Is it stress, environment, their body, what?
Yeah, I mean, there are many factors that can perhaps be a problem. I mean, I think one of the first steps that we take is to review the couple's history, anything from their background. You know, for the lady, is her menstrual cycle regular? Has she had any previous gynecological problems? And, you know, that initial history will allow us to perhaps establish some pointers of where we will turn to. The next step would then be to evaluate and do what's called a primary fertility screen, which would include a test of ovulation, a test of tubal patency, and a semen analysis. And if the lady is over 32, we're usually also going to do an ovarian reserve assessment. Because yes, a woman is born with all of her eggs. We don't make them new. And as we get older, the number and quality of those eggs will decline. And that's a huge factor. And it's also a huge factor as to why is infertility now more common now than it was in our granny's era.
Because everybody's, or most people today are having children later.
Correct.
So for someone out there that says, well, I have to look for that center, what should they look for?
Well, I think choosing the right clinic is a huge decision. I mean, ultimately, obviously, success rate is extremely important. But unfortunately, IVF treatment is also extremely costly, and particularly here in the US.
And I don't think it's covered by insurance.
No, in most states it's not covered by insurance. It's very much something that someone pays for out of their own pocket.
And let's bring in Barbados Center. A lot of people are going there. Why are they going to that location?
Yeah, well, I mean, I think the first thing is when we set Barbados Fertility Centre up, it was set up with a vision, which was that, you know, one of the most important things has to be the key that you are individualizing care, that it's not a conveyor belt, that each couple is different. Is infertility stressful? Yes. But I think that we have to think beyond the basic science. You know, science can push things so far, but we've got to take that holistic approach. And let's face it, surely if we can combine IVF treatment alongside the fact that the patient is also in a relaxed holiday setting, that has got to have a positive impact. It's got to improve things. So, you know, I think Barbados as a destination is a place that certainly is very established as a tourism product. You know, we have twice daily flights from Miami and New York. We have a wonderful group of hotels and accommodation, fantastic restaurants and attractions for people to entertain themselves. At Barbados Fertility Centre, we have a designated staff member who is there to help make that journey easier if need be. And, you know, and I think that as a centre, we have a full complement of a wonderful team of people. One of those people, Dr. Roberta Corona, joined us last year. And I think that very, very importantly, you know, we all have to have the same vision. And that vision has to be that a 1% improvement in success rate is a baby for someone. We must not lose sight of what we do.
And what you do is so special. And I have an email from a couple who sent us their thoughts on what happened with them. And this is what they wrote, and I'd like to share that with our viewers. They wrote, quote, "Last year today, my dreams came true and I gave birth to my son. This past year was the brightest and the happiest year of my life. Anytime I hold my baby, I keep telling myself, this is nothing but a miracle." End quote. How fabulous.
Yeah. It is an unbelievably special feeling to do what we do. You know, I think when a patient comes in to show you their baby proudly at the end of delivery, or perhaps sends those early photographs, and we get that call. We've had calls from patients when, you know, the husband's calling, she's just delivered. He's bawling, crying, and to let you know, and that you're one of the first people that they ring, okay? And I think what it does is it really grounds us. I think it makes us remember why it is that we do what we do.
For our viewers out there who would like information on Barbados Center, what's the website?
Yep, barbadosfertility.com.
barbadosfertility.com. Thank you, Doctor, for what you do. And if you'd like to learn more, log on to our website, thebalancingact.com. You can also follow us on Facebook and Twitter.